Hi everyone, Dr. Nayo here with Rupa YouTube Health Channel. Gonna do a presentation for you today on how do we really make meaningful change to decrease cardiovascular risk. So when I'm working with clients, I'm always thinking about 5 modifiable risk factors to decrease or prevent cardiovascular disease. There are actually 6 or more that we could really be talking about, but sometimes they get a little bit more complex. So I share with my clients the 5 modifiable risk factors that are the lower hanging fruit that everybody can start to address. So let's get started. All right. So as I said, there are 6 modifiable risk factors that I do explore, and probably even beyond that, if I'm being honest. But today we're going to focus on 5 in particular for making sure that we're making meaningful change to help you and your family decrease cardiovascular risk. So why do this? So some of the main things that my clients are actually coming in for is they want to help prevent or reverse hyperlipidemia, or what a lot of functional medicine doctors will call dyslipidemia. And that just means it's disordered cholesterol patterns. So we're seeing things show up in the cholesterol molecules and lipoproteins that are not as favorable for cardiovascular protection for the heart. Hyperlipidemia is just kind of a general statement that conventional medicine doctors will use for high cholesterol. So these risk factors will help to get at both of those issues. It's also going to help to reduce myocardial infarctions, better known as heart attacks, cerebrovascular events or strokes, and thromboembolic events or blood clots. So we want to reduce risk in all those areas because those are the major causes of cardiovascular death. And then we want to optimize cardiovascular health just to support overall general well-being. We also see this translate into better blood pressure, heart rates, and just cardiovascular fitness in general. So these are the 6 modifiable factors that I always like to speak to people about. What I do want to mention, though, is I don't want people to think that I am not taking all of these into account, all of these other modifiable actions that clients can take to reduce cardiovascular risk. One being lifestyle. So generally, how do I show up in the world? How am I eating? How am I moving? How am I sleeping? Body composition. So where am I carrying excess weight if I am? Particularly, you'll hear me talk about in other talks, carrying a lot of middle, we call truncal obesity or visceral fat, so that dangerous fat in the area of the abdomen, which is closer to the organs and very inflammatory. Also, blood pressure is one that I don't want people to not be considering, and smoking status, which we all know is a major toxin and irritant to the cardiovascular system. And even genetics, I didn't put that here, but genetics is something that we also think about. But what's interesting is with genetics, usually when you're addressing these, you have a lot of influence as to whether you actually turn a gene on or off for disease or sickness. So that also, genetics could be a whole other conversation that we can have down the road. And what's also interesting is that usually these 4 action steps or changes that you can make in how you're moving through the world, they usually are enveloped in all of these 6 steps. They are a part of addressing these 6 steps. So I want to be clear that I am very much in favor of making sure that we are optimizing these areas where we're able to, but understanding they kind of fall within the purview of addressing all of these dysfunctional patterns of moving through the world. So let's get at the actual modifiable root causes. So there are 6 modifiable root causes that I think of when I'm working with clients, but if I'm being honest, as a functional medicine doctor, we actually have more than 6. I like to focus on 5 with my clients. Stress is at the top because it's the most important. I always say, I'm actually changing it. I used to say 95% of all disease and illness comes from stress. I'm actually thinking it's more like 99 as I keep working with clients. But stress is almost always one of the root causes that's causing any imbalance in the body. And it's paramount to address this for cardiovascular wellness. So stress would be one. Inflammation, also very important. Insulin resistance, very important. Lipid burden, I'm not going to speak about as much today. This is the one I don't necessarily spell out to clients because it's very complex. We're looking at patterns of cholesterol, markers, apolipoproteins, lipoproteins. So certainly something that we'll walk through, but it's not as straightforward. And then toxicity. So overall, what's the toxic burden that our systems are having to deal with? Okay, so after toxicity, we're going to talk about clotting disorders. Disordered clotting patterns has to do with the blood being too thick, which is one of the root causes that supports cardiovascular disease. So we'll get after that as well. And then you'll see at the center of this is the standard American diet. And in my experience, these 6 modifiable root causes either feed into people wanting to eat the standard American diet, which is very processed, inflammatory, processed carbon, sugar heavy, processed fats, trans fats, things that are very inflammatory and supporting insulin resistance. All of these, the things that make up the standard American diet, they either are encouraged by any one of these root causes or they will exacerbate the root causes. So it becomes a self-perpetuating cycle. So that's why you'll see the standard American diet at the center of this diagram, because it's very important to address and change and let go of the standard American diet in order to really get at these 6 modifiable root causes to actually see meaningful change and ultimately improve cardiovascular wellness. All right, so the first one we're looking at here is stress. Remember I said stress is paramount. Stress is one of these things that it's almost just something that we embrace or accept in this culture. And this is something we really need to be thinking about. As I speak to my clients about this, I'm really thinking about, how am I moving through the world? And that means, am I always in a pattern of rushing? Am I always in a pattern of multitasking? Am I providing enough space for me to actually connect with other people, with my higher power, with my family? This becomes very important. And a lot of times it's become such the norm to be stressed that people don't even realize that they actually are stressed. And I see this result in a lot of different ways with poor health, particularly when we talk about cardiovascular health. The first one that I think about, or marker that I think about, is that it can increase inflammation. On a cardiac risk panel, what I'm looking at as one of the inflammatory markers for heart health is what we call an HSCRP, high sensitivity CRP. So this is a very sensitive marker for inflammation in the heart. So basically we're seeing stress drives inflammation in the heart, but throughout the body. Stress is also going to increase insulin resistance or metabolic disease. This happens through a variety of mechanisms. One, you're going to be more driven to make poor dietary choices. You're probably going to become less active. You are not as capable of responding appropriately with the insulin blood sugar response when you're stressed. So you become more insulin resistant just by stress, even if you didn't make major changes in your diet or exercise. Hypertension or high blood pressure is absolutely driven by stress. One of the patterns that I've seen over my career working with clients is that hypertension or high blood pressure for me has represented where I think I should be here, but I'm actually here. And it's that internal resistance within myself is the pattern that I've seen in people who have high blood pressure. So it's that self-criticism, that internal judgment that I'm not being or I'm not doing what I ought to be doing. And I see that in every person that has high blood pressure. So that's just a thought to be thinking about if you're someone who experiences that. But stress is also definitely drives hypertension in part. Dyslipidemia, I mentioned that earlier. That's this is the different types of cholesterol patterns that can influence cardiovascular disease. We call those atherogenic changes. We can also see stress support elevated fibrinogen level. This is a clotting marker that we'll look at on a cardiac risk profile that supports cardiovascular disease risk. We see this especially higher in men. We also see it higher in postmenopausal women as well. So this is something that we can definitely address and help to reduce cardiovascular risk. Central adiposity, I mentioned this earlier. So this is what we call the dangerous belly fat, the visceral fat, that truncal obesity where you carry that weight in the midsection. And that's very dangerous because it's very pro-inflammation. So the more that we let go of that visceral fat, that dangerous belly fat, that is one of the mechanisms that we let go of inflammation. The reason we bring this up with stress is that when you are stressed, you are more likely to deposit that more pro-inflammatory fat in the midsection. And there's a whole conversation around people who are not necessarily overweight, but they're skinny fat. And that is dangerous. So you may not even know that they're carrying a lot of excess weight because it's deeper, closer to the visceral organs. And so just because you're not overweight does not mean that this cannot be an issue for you. And this is something stress for sure drives. And as I mentioned earlier, stress is going to drive people to be more likely to lean into poor dietary choices. So this is very important to really start to tap into your own patterns of eating. When are you eating? Why are you eating? How are you eating? Are you eating, rushing in between things and standing up? And that's very important because there's a whole digestive response that has to be in place in order for you to properly digest food and take the nutrients, digest, break down the nutrients, but also absorb key nutrients, let go of things that you don't need to be absorbing, toxins and other metabolites that are not necessary. That happens most efficiently and effectively when we're in a calm, rest and restore state. So all these things that you intuitively, instinctively know that, not eating on the run, sitting down, being calm with your meals when you're eating your meals, this is very important beyond just that it's just more pleasant to eat that way. It's very important for your whole digestive and immune system. Then we also know that stress decreases the intake and possibly even the absorption of nutrients. This includes these B vitamins as well as vitamin D and omega-3 fats that are very important for heart health, and there are many more than that. And what we know is that stress can support leaky gut or increase intestinal permeability, which also stress just drives imbalance in the gut in general. So the more that we relax and take that time to set out and have a proper meal in a very calm state, we actually can have a relaxed restorative response to properly digest and absorb. That is key. So stress definitely can interfere with even your absorption of key nutrients. And then stress for sure it shows up as people not being as motivated and having the energy in order to want to get up and to exercise, to take that walk, to be in nature, to just do things that are supportive of overall cardiovascular fitness. So the more that we realize how much stress is playing into disordered patterns in our lifestyle, then we can actually address those, but also understand how it's impacting heart health. So our heart is actually our master organ. It's meant to govern the response and orchestrate how our whole physical system actually works hopefully in concert together. So within that, the heart has both a pumping or constrictive mode that it operates in, as well as a relaxation mode. So it's not even staying in all pumping or all relaxation. There's that perfect balance that is meant to be within the heart. So when we're not actually picking ourselves up out of this stress state and moving over here into the restorative state, that actually is a stressor because there's no relaxation allowed. And my experience is too, when I find that people don't sleep well and don't relax well, these two yin and yang operations in the heart don't work as well. And that's just an anecdotal kind of opinion that I've seen over the years, that when people are not able to rest well, that's one of the ways that you see cardiovascular stress show up. But we directly see that translate into dysfunction within the cardiac system. So that could be like arrhythmias or blood pressure issues, etc. So sleep is a very important one. When you sleep well and rest well, you get into that healing mode. So cannot be understated enough, or cannot be overstated enough, I should say. And then stress down regulates our ability to optimally detoxify our body, both through the kidneys, liver, and other ways that we eliminate toxins and metabolites that our body no longer needs. So this is very important to, again, get over to where rest and restore happens and detoxification happens there as well. So you can see stress keeps you just from a whole healing mode that your system should actually be in. Then we also know that stress is more likely to drive people to drink more. I actually don't think alcohol is one of those things that we need to be drinking, but there is some pretty strong data that less than one drink a day in women is where kind of the cutoff is, where where alcohol above that becomes more of a toxin. And then for men, it's less than 2 drinks a day. Thyroid dysfunction is also one that people don't think of. We can see both at the level of the hypothalamus, the pituitary, the thyroid, and then actually the conversion of thyroid hormone, that stress actually impairs the thyroid function from all those levels. So again, the reason we're talking about thyroid in this conversation is the thyroid actually has a lot of impact on the heart. And the way that most people will know about it is cholesterol patterns get influenced by thyroid function. So that's important to be aware of. And then epigenetic changes, this just means that, as I was mentioning at the start of this conversation, that genetics are there. So people have different genetic patterns that may influence disease or not. But there's a whole field of science called epigenetics, which means above the gene. And that they're finding that the behaviors, the way we think, the way we sleep, etc., all these things that you actually have power over, they actually will influence whether you turn a gene on or not. And so even though you may have genetic propensities to actually have more cardiovascular risk, you can influence that with lifestyle, but most importantly, your thoughts. And then anxiety, depression, and mental health disorders. These disorders are definitely impacted by stress, but they then also impact cardiovascular wellness. So something also to be considered. Okay, so what are some key markers of stress that you just may want to know about or ask your doctor to assess? If you're working with a functional medicine provider, they're almost always going to address one of these at some point to look at stress. So the first one you see here is DHAS or DHA sulfate. This is a blood or a serum test that we'll do. It's the easiest way to assess stress by a blood test. So my optimal range is about 150 to 200 for this. This is one of the stress hormones that works with cortisol. So it's not directly telling us about your cortisol response, but it's a very good surrogate marker to look at stress. So that's one way that we can look at it. A lot of times, if you're working with a functional medicine provider, they're going to do either a Dutch or salivary adrenal test, and that can tell us about your cortisol curve, which is just looking at your cortisol response over a day period to know what is your stress response, what is the pattern that we're finding, how are you responding to stress? Are you responding well? Is there an overactive stress response? Are you not able to appropriately respond to stress? And this all becomes very important for cardiovascular wellness, because if you're stressed, it's very hard to get into a healing response. It's hard to get into a restorative state of sleep. So this has direct impact for heart health. And then there's also something called a cortisol awakening response, or a CAR, that you'll hear functional medicine doctors talk about. And this can tell us a lot about capturing your stress response as well. And then DHA, we can also assess this. This is one of the buddy hormones of cortisol. We can also assess this, and usually this would be on either a Dutch or a salivary adrenal test. So these are ways that we can get an idea of what is your stress pattern, and are you appropriately dealing with stress, or does it look like you're taking too much stress into your system and therefore living too much over here in fight or flight and not enough over here in rest and restore. So that was stress. So now let's move on to inflammation. So this is a very important modifiable root cause that we definitely want to be assessing. And why? Why do we care about inflammation for the heart? It's maybe not something that most people would think about with cardiovascular disease. We think about cholesterol, we maybe even think about clotting, but a lot of people don't think about inflammation. But inflammation, one of the things that has been uncovered is that part of what's going on with cardiovascular disease is there's a inflammatory immune response that's at the foundation of this. So inflammation supports insulin resistance. We know that's very closely intertwined with cardiovascular disease. Dyslipidemia, again, those abnormal or dysfunctional patterns of cholesterol that support cardiovascular disease. Hypertension or high blood pressure, we know that's a risk factor for cardiovascular disease. That central adiposity that I talked to you about, that dangerous belly fat that's very inflammatory. Thyroid dysfunction. In my experience, I find that for thyroid disease, one of the things that I see that's at the root cause of thyroid dysfunction is inflammation. So remember, I said thyroid directly impacts the heart because it creates dysfunctional patterns of cholesterol. And that's probably the most common way, but there are other ways that the thyroid is impacting heart health. Stress, whether it's psychological, internal, physical, all of that is also driven by inflammation. So I have a lot of clients who will come in to see me, and I will pick up that they have stress going on, either because of the markers that I'm seeing or what they're telling me. And what I will have some clients say is that they're not stressed at all. They don't feel stressed at all. And when I usually see that, that's either someone who's not necessarily, they're more of a stoic person, and so they don't feel it on the surface of their own experience, so they're not even aware of it. The other thing that I see happens is that there may be something internal going on, so a lot of gut inflammation, or if they're having pain, that's another form of stress. So we need to be very mindful of how inflammation is also driving stress, because remember, if you're sitting over here all the time in pain or imbalance in your gut or whatever the internal stress could be, or you're just stressed with all that is on your plate, you sit over here in fight or flight and you're not in the healing, resting, restorative mode. So it's very important to see the interplay between all of these root causes. Then we have mental health disorders. Inflammation can support that in the way that if the brain becomes more and more inflamed, that is one of what we're finding more and more, one of the drivers of mental health disorders or imbalances. Hypertriglyceridemia, this just means you have high levels of triglycerides. That is one of the three reasons people tend to have high triglycerides. It's generally either inflammation, insulin resistance, or processed diet. There can also be a genetic propensity for that, but I find that those are the three root causes that drive that. And so inflammation is really important to get triglycerides down, because this is when these levels are high, that's a very dysfunctional pattern for cardiac health. And then we also know that inflammation supports poor absorption, intake of key minerals and nutrients, which we already elucidated. What do we want to look at to assess for key markers of inflammation in the heart? One of them, if you get a cardiac risk profile with a functional medicine doctor, which I would suggest most people get, because it's just a very interesting test to get a lot more information about heart health. But one of the markers that we see on a cardiac risk profile is a marker called myeloperoxidase. If this level is high, which this is an inflammation marker in the heart, we'll see reduce what we call bioavailability of nitric oxide. This is important because this is a molecule that's necessary for the relaxation response of vessels. So if we don't have nitric oxide available, that's not helpful to the cardiovascular system. It also impairs reverse cholesterol transport because it inhibits HDL cholesterol, or calculated HDL, which is very important for actually supporting and pulling out the more damaging atherogenic LDL particles. So this is important when we have higher levels of myeloperoxidase, that process does not happen. The HDL can't get into the tissue and pull out that oxidized LDL. So that's important. We know high myeloperoxidase markers also are aligned with endothelial dysfunction. All this means is that inside the arteries, there's endothelial tissue, and that is very important. When that becomes inflamed or dysfunctional, that's one of the steps in the inflammatory process that supports cardiovascular disease. We also know that higher levels of myeloperoxidase support foam cells and plaque progression in vessels. These, again, are part of what is creating or supporting atherogenesis in the vessels. This may also be a predictor of cardiovascular risk in healthy people. That's one of the things that has been seen in studies. It also supports, when the levels are higher, more plaque instability and increase in cardiovascular risk, a cardiovascular risk event. What this really means is that we have plaque that could be forming in the vessels, in the arteries specifically, and then with these levels are higher, that plaque is more fragile and could break away, which is part of the cardiovascular risk. If that plaque is not stable, that's a problem because it can break off and then lead to a cardiovascular event like a heart attack. We also look at relative risk for some of these markers. So what we have seen is that when people have higher levels of myeloperoxidase, they can have 20 times increased risk for coronary artery disease, 5 times increased risk for a myocardial infarction, 2 times increased risk for cardiovascular mortality. Now take all these numbers and put them into context, because I'll see these panels over and over and over again, and I'll see people with high myeloperoxidase markers, but but we can get them down. So if you ever do one of these studies and things aren't looking favorable, and then you look back to this presentation and you see, oh my God, I have this. Does this mean, one of these events is imminent for me? No. One of the reasons I love doing these panels, these cardiac risk profile panels, is because I get such just pleasure out of just elucidating with people how these markers are information and opportunities for us to support wellness. They're not diagnoses that are irreversible. So all of this risk that you may or may not see with higher levels, it can be reversed. So I use this more to encourage clients to make a shift and not to be afraid. And then I always like to share what are the optimal levels. So depending on the lab that you're looking at, it's going to be less than 400 or less than 420. So this is the level of mild peroxidase that we're shooting for, and that's very achievable, just so you know. Okay, so other markers of inflammation. I put this apple here, so on the left you see the flesh of a nice fresh apple, and here you see the flesh of a apple that's been exposed to oxygen for some period. This is oxidation. So it's just kind of a visual for you to be able to understand how oxidative stress it works in our body. So you have just really healthy flesh, or in our system, tissue. And then over time, if oxidative stress is allowed to ensue, we start to have more rust and breakdown. So this is a key marker we look at on a cardiac risk profile. It's called urinary F2 isoprostanes. We don't want high levels of these. They are a marker of chronic inflammation, which then leads to oxidative stress. They're also supported with chronic disease, and they can play a role in clot formation. We can see that the more increased stress that you have, that is actually going to support more oxidative stress in the wall of the artery. And remember, I said that artery is really important because that is where a lot of those atherogenic changes are beginning to happen. It can also, when these levels are higher, the F2 isoprostanes, can support more development of and progression of atherosclerosis. So those changes within the vessel that support the actual disease process that supports cardiovascular events. It also is known to be an independent risk factor for coronary artery disease. It's associated with certain forms of cancer, lung and breast are two that are top of mind. It's also associated with smoking. We know in general, one of the effects of cigarette smoking is oxidative stress. Red meat intake has also been aligned with higher levels of urinary F2 isoprostanes. A sedentary life is as well. So this is a test, as I mentioned, it's a urinary test. It's usually part of this cardiac risk profile that we will use to assess cardiovascular risk. So it's a very easy, accessible test to do. So what are the relative risks that we see with this inflammation marker? If the levels are higher, it can support 9 times increased risk of coronary artery disease. Again, putting that in context, it doesn't mean just because you have a higher level that there's going to be a cardiovascular event. We use these to reverse the risk and to move toward health. So the optimal level that we'd like to see is less than 0.86. Okay, so our next inflammation marker for the heart is called Lp(PLA2). So we look at the activity of this. We call it Lp(PLA2) activity. It's an enzyme that's associated with atherosclerotic lesions. So remember, those are the changes within the artery of the heart, or one of the arteries or one or more arteries in the heart that supports those cardiovascular events. It also indicates that there may be more arterial inflammation that's associated with coronary artery disease or ischemic stroke. Ischemic stroke is the type of change in the brain where you have that plaque building up in the brain. It serves as an independent risk factor for cardiovascular disease. We know that higher levels of this in the serum may indicate that the plaque within an artery is more vulnerable, inflamed, and likely to rupture. And so we want to be really aware of that, and that this can correlate with a coronary calcification, which are changes that cardiologists and other heart specialists look at to assess cardiovascular risk. So Lp(PLA2) activity is another one of my favorite ones to look at because it's one of those that's easily and quickly reversible, and it's very meaningful because you can see a lot of this. There's a lot of risk here when you read through how this activity, if it's too high, supports disease. So it's one of those, it's very, very cool to look at with patients and then come back 3 months later and see it completely normalized. And so the relative risk that we can see if this level is high is that you can have 2 times increased risk for cardiovascular disease. You can have up to 5.5 increased risk for cerebrovascular accident or stroke. Again, put context around that. Doesn't mean if your level's high, something's going to negatively happen in terms of cardiovascular health. It's one of the most rewarding tests to look at with people because we do see this reverse pretty easily with supplementation and changes in diet. Overall, the optimal level that I'm shooting for LP-PLA2 activity is less than 75. So our next one is ferritin. So this one may be one that we wouldn't think of intuitively as much for heart health. So ferritin, we don't want this excessively high. It's a way that we look at iron storage in the body. And the reason we care about this for heart health is when it's elevated, it may be supporting cellular injury. So that means injury at the level of the cell. We call this an acute phase reactant. So sometimes acutely when someone's ill or not feeling well, we'll see the ferritin go up. If this stays high, it really is a sign of chronic inflammation at times. It can be. One of the other things that a high ferritin level can be associated with is too much iron. So iron overload is not great because it builds up in the tissue, most notably in the liver. It can support oxidative stress, insulin resistance, endothelial inflammations, maybe that's that inflammation in the artery, as well as high blood pressure or hypertension is what I've noted there. It can also be associated with metabolic disease or syndrome, diabetes, cardiovascular disease that is specifically so associated with iron overload. So the two can go hand in hand. Iron itself can support some of those metabolic disturbances. If you have a higher ferritin level, the relative risk can be that it can support metabolic syndrome. What we see is that it can be 3 times increased risk for metabolic syndrome in people with the higher levels. So they're in the highest quartile. That's the higher upper fourth part of the range that you'll see on a lab test. And that's compared to the people in the lowest fourth or quartile of the range of the lab tests. We also have seen that there can be up to 1.7 times increased risk of type 2 diabetes for patients, again, in the highest versus the lowest quartile. An optimal level is generally less than 61, but that's going to change a little bit depending on the lab range. But generally, you want to have appropriate levels because that means that you have enough iron stores available, which is very important, especially for menstruating women. But you don't want to have excessive levels where it means it can be building up in the tissue and supporting metabolic disturbance, or it can be a sign of cellular inflammation or injury. Okay, so moving on. So another key marker we're going to be looking at for inflammation in the heart is your omega-3 index. This is another very rewarding one to look at. So basically, when we're looking at an omega-3 index, that's also going to be part of a cardiac risk profile for a lot of functional medicine providers. We're assessing what is the amount of omega-3 fatty acids in the specimen, most particularly the EPA and DHA levels. Very important because having EPA in particular is very heart protective. DHA is also an important one, but looking at the index helps us to know how can we add more essential fatty acids, namely omega-3 fats, to help turn down inflammation, directly decrease high cholesterol. I've also seen it play a role in clotting disorders, but how can we increase this index more favorably to move the pattern from more of an inflammatory dysfunctional pattern to more of a anti-inflammatory functional cardiac pattern? So why do we care about omega-3s? They support a healthy heart rate, blood pressure, triglyceride levels, myocardial efficiency, which just means the tissue in the heart, the efficiency of the tissue in the heart, down-regulated inflammatory response, so there's less inflammation, and then endothelial function. Remember, that's more in the vessel on a cellular level, how that tissue actually functions. So a high-risk range would be if your level is less than 4%. That's very low. That means you don't have a lot of omega-3 fats to support all of these supportive cardiac functions in the body. It also means that there can be up to 10 times increased risk for sudden cardiac death for those who have a 4% versus an 8% index. So what that just means is that if I'm at 4% or lower, I'm setting myself up more for a risk for sudden cardiac death than if I had a higher level at about 8%. Intermediate risk range is around 4 to 8%. So again, not as optimal because we're shooting really for 8 to 10%. I'll stay with 8% if I don't have tons of cardiac risk, and whether it's through other markers that I'm looking at, blood pressure, clotting issues, etc., then I'm usually going to shoot more for 8%. If there's a lot of cardiac risk, or if the patient's not responding to what I'm doing with other supplements and interventions, then I may shoot more for 10%. The optimal index for omega-3 fats is somewhere at around 8 to 10%. Generally, also, when you look at an omega-3 index, you're also going to get an omega-6 index along with that. Omega-6s are not all bad. However, you want an optimal ratio between omega-3s to omega-6s. And you want to be getting omega-6s from the right sources. Most people who have high omega-6 indexes at baseline, it's usually they're getting them from more inflammatory fats, trans acids, seed oils, things of that sort. Whereas there can be healthy ways that you're getting them in through like a borage oil and evening primrose oil. So again, not all bad, but you want to have the proper balance between omega-3s and 6s and getting the omega-6s from the right sources. Okay, so now getting to our next modifiable cause. We just tackled inflammation. Now we're at insulin resistance. So this is, I think, pretty intuitive by now to most people that insulin resistance or metabolic disease supports a lot of cardiovascular risks, including dyslipidemia. It also supports or does not allow the ability to detoxify as optimally, mostly by impacting the detoxification systems. It supports oxidative stress and inflammation. So remember, that's that rust and chronic inflammation. It supports increased cardiovascular risks and metabolic complications that come along with insulin resistance, like liver disease and other organs that can be damaged by elevated blood sugar all the time. It can also support developing high blood pressure or hypertension. It also supports that dangerous belly fat called central adiposity. So what are some markers of insulin resistance? One that probably everyone has probably heard of by now is looking at your hemoglobin A1C, the percentage of that. This is one of my favorite ones too. So it's the way that an A1C helps us is that glucose can attach to a hemoglobin molecule. And that's what we're measuring when we're looking at an A1C percentage, or how much glucose, what is the percentage in the sample of glucose attached to the hemoglobin molecule. So it's looking at the attachment of glucose to hemoglobin, and it's looking at the amount of glucose that's attaching to that hemoglobin molecule and the total in your specimen. This represents an average blood sugar over 3 months. So it's a very great long-term marker to help my clients be able to see, are they actually moving the needle and actually moving away from insulin resistance or not. So it's very helpful. It's not going to be immediately affected by your meal or anything like that. It also is a marker for assessing diabetic risk and the complications that can ensue from diabetes. A higher A1C is known to be associated with increased cardiovascular risk. So this, I put kind of a little bit different, looking at the levels a little bit differently. When I'm working with a patient, I want their A1C less than 5. That is not necessarily what everybody is doing, but that reflects in estimated average glucose of 97. So that means throughout the course of 3 months, if your A1C is at 5, your average blood sugar is about 97 if you averaged it out between your highs and lows. So that you can see if you go above that, then your blood sugar on average is higher than we would prefer. So when you look at a lot of standard labs, they're going to say a normal A1C is anything under 5.6 or less, because that's considered normal, not pre-diabetic. The problem that I have with that is if you wait until somebody gets to 5.6, 5.7, there's already been so much damage that's happened with the insulin resistance that you're going to have to reverse. So I like to help people to either return to a lower blood sugar overall more quickly, or get it earlier than later, or if they're already optimal, keeping it that way. So your intermediate risk, people are going to say, is about 5.7 to 6.4. That is when you actually meet the criteria by an A1C for being pre-diabetic. And then a high risk level is above 6.4, and that's also when you're meeting the criteria for diabetes. That reflects an estimated average glucose of 140. When we're doing a fasting glucose on somebody, we want your glucose, I like to see it under 90. So that kind of gives you an idea that if you're overall at 140 on average, that you're probably at fasting not going to be getting to a level of 90 for your blood glucose. Fructosamine is one of my favorite ones. This may or may not be one that you heard of a lot. This reflects your blood sugar over 2 to 3 weeks. And I like this one because unlike your blood glucose, it's not going to be affected immediately by meals. Maybe like if you were partying more, or more alcohol intake, or more you went on a vacation and you indulged more, you may see that change. But I still like that because I like my clients to be able to see, okay, this is what happens to your blood sugar when you overindulge in whatever it is people tend to enjoy. So, but it's also nice because it's not going to, people can't tell me, oh, I just ate whatever that morning and that's why my blood sugar's high. It's more of a shorter term marker, but it's not affected immediately by what they eat that day. This does correlate with diabetic microvascular changes like chronic kidney disease, diabetic retinopathy, and more. So it's also helpful when we're looking at the complications of insulin resistance or diabetes. It helps us to be able to help clients to understand how they're doing with that. Another reason I like this in addition to a person's A1C, is it's going to help you to see where you're making changes earlier. Because with an A1C, as I said, it's an average. It's looking at an average blood sugar over 3 months. This one, you can start to see changes in a month, where you can really start to see that level drop. So this is really helpful for clients to see the changes that they're making meaningful. So I like to see a level lower 200s. You'll see the range around 200 to 285. But again, once you're getting up to 285, that's too high. Other markers we look at are insulin, your hormone. This is a hormone responsible for regulating blood glucose. I'm not going to get too deep into this because it becomes a little bit more complex, but it's very important, impacts cardiovascular health directly. I like to get a fasting insulin level. Is very helpful for us to be able to know whether insulin resistance is developing even before we see those changes in a fructosamine or an A1C. So I like to see a fasting insulin less than 5. Some of the labs will call a fasting insulin 12.4 to 16 is normal. Again, that's too high. Once you're getting above 5, you're in insulin resistance. And it's designated as having a high fasting insulin is above 16. The relative risk of a high insulin is that you may have a 6 times increased risk for ischemic heart disease, insulin resistance, or metabolic disease, and diabetes. These are some other tests just want you to be aware of. So when you're doing a cardiac risk panel or you're working with a functional medicine doctor, they may be looking at a HOMA-IR score, or an insulin resistance score, or a C-peptide level. All right, so next we have lipid burden. I'm not going to spend a lot of time today, as I mentioned, going over this because this is very complex, but just know that it is a modifiable factor. This is when we're looking at the types and sizes of the different and levels of the different lipoprotein markers that we can address to reduce cardiovascular risk. So the next one we're going to address is toxicity. So when we're thinking of toxicity, we don't want a high toxic burden because that's going to support oxidative stress. Remember, that's that rust in the tissue. Going to increase toxic load of heavy metals potentially, or environmental pollutants. It may also support toxic metabolites that can support inflammation, stress, and dysfunctional patterns of cholesterol called dyslipidemia. Some of the tests you may see your functional medicine provider check. Generally, my experience, I'm going to check these later. I'm going to kind of address nutrition and some of the things we've already mentioned. But down the line, if I'm not seeing that the interventions that I'm making are making meaningful enough changes, the first thing I'm going to be thinking about is assessing someone's gut with a functional stool analysis, potentially doing a heavy metal panel, a metabolomics panel, which helps us to look at different metabolites and imbalances that could be occurring that could support disease or disorders, or a micronutrient panel. So those are kind of down the line tests that we want to be looking at. The lower hanging fruit that I want to address in terms of toxicity is oxidative stress. And then if there are any known toxins, just in general, so just supporting people's ability to detoxify optimally through their kidneys, their liver, their skin, through sweating, etc. All right, now we have our last one, clotting disorders. So this one is called urinary 11-DHTXP2. I call this sticky platelets. This is another urine test that is a part of a cardiac risk profile. It reflects the level of platelet activation and possible thrombosis, which is just a fancy word for clotting. And this can be due to atherosclerotic changes or deposits or obstructions that are happening in the vessels. It's very important because this is another one that you can really address to decrease clotting risk, which is one of the steps that is necessary for cardiovascular disease to ensue. It's used to assess the need for aspirin or supplement that decreases platelet activation and thrombosis. It also can be used to assess once a patient's on aspirin or a supplement that's addressing platelet activity. So it's really helpful for us to know, basically, are we thinning the blood out enough, which really just means, are we decreasing the platelet activity that's causing clumping and clotting that can support cardiovascular risk. This is known to be an independent predictor of risk for heart attack, which is an MI, or stroke, or cardiovascular death. The relative risk that we've seen with a higher 11-DHTXP2 level is 4 times increased risk for cardiovascular disease. So it's a really meaningful one that we can address and reverse. Fibrinogen is another marker of disorder clotting. This fibrinogen is a protein that converts to fibrin, which actually helps to form clots. This is also known as an acute phase reactant to inflammation, atherosclerotic changes in the arteries. So again, remember, acute phase reactant is something that can go up in response acutely to something going on disorderly in the body. High levels of fibrinogen are associated with increased cardiovascular disease. This protein is really important because it helps to assess the viscosity or thickness of the blood and platelet aggregation. So remember, I said one of the steps in cardiovascular disease is clotting. And when we have higher fibrinogen levels and it's excessive, that is problematic because the blood's too thick and clots too easily. So this is another really meaningful one that we can see reverse pretty quickly. When we do have higher levels of it, it's more associated with what we call prothrombotic states. That's just when the body has an easier or too easy time making clots. So we want the body to be able to clot appropriately when there's some sort of internal injury or we cut ourselves. But if it's doing that too easily, it's too much of a setup for cardiovascular risk. It's also, when elevated, can be an independent risk factor for stroke. Overall, what we've seen is the relative risk with high fibrinogen levels are that it can be a 2 to 3 times increased risk for cardiovascular disease. So these are 6 modifiable causes of cardiovascular disease that we've looked at. And then remember, we've got our everyday modifications that we can be assessing and addressing. And then at the core of it all, adjusting and getting rid of that standard American diet. So what do I want to leave you with some takeaway points? I want you to modify your cardiovascular risk by working with a functional medicine provider to move that system toward health. We can do this working with you to reduce stress. There are lots of ways for us to assess and actually help you reduce stress. We want to decrease the inflammatory burden and immune dysregulation in the body. So we want to turn that immune response so that it's more dealing with supporting an active, healthy immune system rather than over here always trying to put out a fire. We also will help you in reversing insulin resistance and assessing that. We'll help you to reduce lipid burden and reverse those dysfunctional patterns of high cholesterol. We want to support your detoxification pathways and helping to eliminate toxic exposure for you. And then we always will be helping you to reverse and reduce clotting pathways if they're dysfunctional. So you can see just by doing this cardiac risk profile, you learn a lot of inflammation. And although we're talking about the cardiovascular system at this point, the more that we actually start addressing this, remember when we talk in functional medicine, we may be talking about that one system, but every time we make a change in one system, it's actually impacting the whole health of our whole body, because it's not a closed container. One system is not a closed container. There's so much interplay and communication between the systems. So when you turn the noise down in one system, you turn it down in the other. So thank you so much for your time and listening. I hope this was helpful, and I hope to see you soon.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.